Hi, welcome to the Arkansas State Physical Therapist Assistant Clinical Education Program. I'm Farley Schweiger, the current Director of Clinical Education. If you are partnering with us, then you've been either talking to me or my counterpart at the Mountain Home campus, Richard Byram. We first want to say thank you. Thank you so much for partnering with us and helping our students learn. We know that this is a time-consuming process, but we really appreciate you and your desire to push the profession forward and help the next generation. Some things to know about the PTA program at Arkansas State. It's an accelerated program in that it is a one-year program. These students start in June and they'll graduate the following May. There are 3 clinicals within this year, and they're either a 5 or 6-week clinical. PTA students can be supervised by either PTs or PTAs. So that gives us a wider range of options for our students in the clinic. The way the process works is after we've been in communication and confirmed that you're willing to take a student for those dates, I will send you an email with the student information. I will also send your clinic email, your clinic information in an email to the student. They are then directed to write a professional letter introducing themselves and their goals and asking questions about where you want them, what time you want them at the clinic, and different things like that. These clinicals have a couple of assignments that are due during the clinical. The week 1 assignment is an orientation checklist. On this checklist, it has a series of things to go over to make sure that we have gone through all the policies and procedures of your clinic, that everybody understands what's going on for the next 5 or 6 weeks, and to have all the information about the clinical instructor returned to me, so that if you are a brand new clinical instructor, I can go ahead and get you set up in the CPI and help you navigate the training for that. After that happens, you're pretty good until about week 3. Week 3 is our midterm for either clinical that the CPI must be completed by both the student and the CI. We here at Arkansas State use a CPI for both the midterm and the final checklist for the clinical. We understand that this tool can be a little bit time consuming and a little bit daunting, but understand that taking time throughout that whole 3rd week or final week may be helpful in getting it done, because it will save where you're at and return you there to a later date. The reason why we really like still being able to use the CPI at midterm, because it identifies not only clinical issues, but maybe professional issues, and it gives a really good solid foundation that if there is an issue in the clinic, we can work together to address that with the student. So I want to show you what some of these look like. I'm going to share my screen, and we'll talk about some of the other assignments that the students have to do. So this is what the orientation checklist looks like. It just is getting all the information about the clinic, the CI, whether the CI is a new CI and we need to complete the CPI training, and just going over that you've gone over infection control policies, emergency procedures, all the things that happen either on the first day or throughout the first week to get the student acclimated to your policies and your clinic. When you get into the CPI, here's what it looks like at the beginning, and you'll have your evaluations. When I go in after the checklist returns to me, I go in and pair the CI and the student. So then you'll be able to just click onto that evaluation, and it'll take you to a new page and allow you to start going through the CPI. Other assignments that we have for the students while they are on clinic with you is an interprofessional clinical interaction. This is where we ask the student to work with another discipline. That can be whatever other disciplines that you work with in your clinic, whether that is OT, speech, nursing, rad tech, PA, nurse practitioner, physician, working with them in a situation to learn more about how other disciplines work with physical therapy. This is just a fill-in-the-blank document that the student is majority, the student's going to fill out the majority of this document. And they're just going to answer through questions about describing the situation, their knowledge base, pre and post situation, along with how what they have learned can now be used in their own practice as they're becoming a PTA, and then a place for you to provide comments about that situation, and a place for both of you guys to sign. We have another form that looks very similar to this one. Not only do we ask that they have an interprofessional experience, we ask that they have a PTA clinical experience. So we ask that they work directly with the PT. For some of you guys who are serving as a CI and are a PT, that might be easier to facilitate than the CIs who are PTAs. But nonetheless, we ask that the student work directly with the PT, whether it's sitting in on an evaluation and observing how that works, or doing a co-treatment with the PT, however that looks for your clinical experience. This form is very similar in that we ask that you describe the situation. And this is a student working through all these questions. They describe the situation, they describe their pre-knowledge, their post-knowledge to the situation, how that new knowledge is going to be incorporated into their own practice. We ask that they do it, whether this activity is all through an evaluation or a co-treatment. We do ask that they observe an evaluation while they are on their clinical experience to answer the fifth question. And then any comments from you and a signature from both of you guys. The other thing the students have to do once within all three of their clinicals is that they have to give an in-service at least once for requirements here at Arkansas State. You may require an in-service of your clinical, and that's fine. Even if the student has already completed one for their requirements here at school, they can complete other in-services for other clinical experiences. When we are doing the in-service, we ask that this evaluation form be filled out by you and any other therapists who are attending the in-service. And the student must submit this along with their in-service material back to their Blackboard location. On the fifth week, the CPI is again due. That is the final task for the clinical, the fifth or sixth week, depending upon the clinical. It's due by that Friday. So getting all of that planned out, you know, the final week often sneaks up on CIs and students. But if you get that kind of timed out and planned out to get done throughout the week, it's usually a little bit easier. We want you to know that here at Arkansas State, we are here to support you and our students in the clinic and provide any support we need to along the clinical experience. If that means doing an in-person visit or a Zoom call or just a phone call or by text, whatever method works and whatever interval that works for both you and the student and whatever's going on in that situation. We also want you to know that the grading process for clinical education is on a pass-fail for the student. And that final grade determination is made by the DCE. It is heavily weighted by what the CPI says, and it is also weighted with what the student has to fill out and turn in, and along with their time card aspect of their clinical. We ask that all of our students fill out a timesheet and keep track of their hours and turn them in just like you would as an employee in certain situations. So by having all their assignments turned in, what is being said for the CPI for both the student and from the clinical instructor, all those things are weighted together to determine their pass-fail. We are in a lockstep program, so if a student does not advance through that clinical, then we have other alternatives to either work through that if time allows, or they're not allowed to make academic progression through the program, and we go through that change with them. So there's a lot of options. There's a lot of options there, but I want to clarify what the grading process is like, because a lot of CIs are like, I don't want to fail a student. Well, it's not all just on what's said in the CPI. It's the overall experience. Additionally, we want to just remind you guys of what entry level actually means. For therapists who have been out for a very long time, they forget what it was like to be a new grad. Entry level means safe and competent at the entry level, that they could carry a caseload and be independent and safe with that. So don't forget, if you have been working a lot of years, have gone through a lot of other advanced trainings, that your lens now looks a lot different than your lens did when you started as a new grad. So bear that in mind as you are helping these students advance through the CPI levels. Again, we want to say thank you for your time and support of the clinical education process, and know that we are here to support you and help you in any way that we can. Thank you, and wolves up.